Hello, everyone, and welcome to the Quorum Podcast. This is where academic medicine meets remote, austere, and resource-limited areas. Welcome back to the program. This is Aebhric O'Kelly. This week, we're in Malta running the Tropical Travel and Expedition Medicine Skills course. Jason Jarvis and I designed this course a decade ago, and we continue to update and enhance it. To be honest, at the time, I knew very little about tropical diseases, so we created the TTEMS course primarily so I could sit in the back of the classroom and listen to the lecturers talk about tropical disease. This is how I learned, by hearing the same thing over and over and over again. I invited guest instructors who had tons of experience in tropical diseases as I frantically took notes in the back of the classroom whilst they were teaching our students. After running this 6 or 7 times, I culminated my TropMed learning by doing the Diploma in Tropical Nursing from London School of Hygiene Tropical Medicine, and then finally felt I had enough training experience to start giving these TTEMS lectures myself. For this podcast, I will be inviting a few of our students who are currently attending the TTEMS course. So with me are 4 of our bachelor's degree students who are going through the TTEMS course, and of course they'll be here for next week in the eye care. But so I wanted to hear from you, lads. So if you start out, and every time you say something, just say who you are so we can kind of keep track of things. And tell us who you are and how you've liked the week so far.
All right, so my name is Splinter, and I'm from the Netherlands. I found the college through a whole process, but I'm here to explain about what I found of the course. And what I found is that it's really different to how previous studies have been, how previous teachings has been, as it's been really individual and also allowing me to roam outside of the coursework and the stuff that we have to learn. And it also gives me a lot of space to roam freely and to find my interests and some things that the instructors might not know. And it leads to very interesting conversations within the classroom. And regarding the TTEMS, yeah, it's been a lot of fun. There's a lot of expertise here, and a lot of expertise which is also signaling to me like I want to be on that level. I like that. And although I find it very challenging to learn about how these disease processes work, such as the microbiology and all these medications and their interactions, it is something I find really interesting to hear the instructors talk about and fellow classmates and have discussions about these things. So that's what I find about it.
So I'm Finn. Yeah, no, the week has been dead good. Being able to speak to, people of loads of different backgrounds. We have 2 doctors, a few paramedics, and a nurse. So it's been pretty good. I'm enjoying it so far.
Yeah, my name is Maxim. I'm a paramedic from Germany, currently living and working in Ukraine. And this course I enjoyed very much so far, the first 4 days. It's very different to my previous job in Germany and my work now in Ukraine. So there's a lot of new topics for me, and there was a lot of material to prepare for this course. And I'm very happy that there's a very great instructor to student ratio, that you can have all your questions answered and get a really good explanation of everything. And I really liked it so far.
I'm Connor from the United States. I'm a paramedic, and obviously we don't get a whole lot of the primary care aspect in paramedic school there. So it's all new to me. It's all super interesting. Dentistry, tropical med. So yeah, learning a lot, really having a good time.
So if you guys could pick a top 3 list of things that you've learned this week so far, what would you say? So we have to narrow it down. And what are the top 3 lessons learned that you're going to take back to your own practice?
Yeah, this is Finn. I think the most interesting thing I've learned through the week was the venous cut down. It's something I've never seen before, never heard of it. Being able to see it, how it's done was quite interesting. Something else, it's not so much one particular thing, it's broader, but it's being able to see how people from different countries practice differently. So, in Europe, we have some different equipment compared to the Americans and the other way around.
Yeah, so I'm Splinter, once again, completely backing what Finn said, 100% agree on his topics. One of the things that really piqued my interest was improvised medicine and how the things that we find really standard around us, like in the kitchen or wherever, that a lot of that stuff can be used in a way to actually treat patients. And that's something that really, it put me to think, like, how can I use this? I just have a random object in my hand, and it's like, oh, how could I use this to treat a patient? How could I help someone with this? I really like the tropical medicine. as I mentioned, just the way things work and the moments where you're in class watching a video of a worm being pulled out of a guy's foot and everyone's squeamish about that. It's those are the good moments, but also the very teachable moments. Yeah, the Venus cut down was really interesting, and I've lost my third point. Stick with that.
Yeah, this is Maxime. I really enjoyed our prolonged field care scenario that we did because I'm also, compared to my previous job in Germany, now I'm transferring patients for like 14 hours, sometimes even longer. And it was interesting to be in like a different scenario that also can take even like more than a day. And what are the things you need to think about and how can you solve it in an austere environment. Also, I really enjoyed the suturing class and all the techniques we learned, like how can we improvise if we don't have the ideal equipment, what are other options to deal with this and to still get some kind of proper wound care. And the third point, well, it can be many different things. I would say the dentistry really was interesting, but also what Splinter said, the improvised medical things. Even more interesting about this, that there's real evidence behind it, not just like, okay, we try something and maybe it works, but it's like completely backed by evidence. This was for me like, really, really interesting.
Yeah, this is Connor. I'll first second something Max said, which is the evidence-based approach to everything. So even when we're improvising, having a actual evidence-based approach to that is really going to be applicable back home to my current practice. Other interesting stuff, all the skills, the suturing is something that I didn't get to do in paramedic school, obviously. So the suturing, all the tropical diseases, being able to recognize those, some of those are becoming more prevalent in the U.S. as well, where I'm in Texas.
So think about what you've learned so far and tell me something that you would have liked to see in your TTEMS, or even we can talk about the BSc in general after this, but just go through and think about what would you have liked to see this week.
So this is Splinter. In general, more. Just teach me more. Feed this head of mine that just craves for more. I wanna hear Jason Jarvis talk more about his tropical medicine and his experiences with that, and just give me more. I want to understand more principles of this microbiology and how drug interactions work with certain malaria chemoprophylaxis, for example. I want to understand more about this dentistry stuff. I can't wait to graduate, but I can't wait to move on and understand and learn more and find more and just become better. So one of the things I'm missing, but not really missing, is just more information, just more in depth. I want to really understand how these disease processes work. I want to really understand like what more can we do with improvised med? What more can we learn? What more can we teach? So that's it's definitely not a shortcoming of TTEMS, but I can't wait to learn more, to find more, to read more.
Connor here. I'd say the one big thing that I'd want to see more of would be the laboratory diagnosis. That was super interesting to me. Maybe going a little bit more into that, and then just having more free time to work on skills, I would say. Free time to work on whatever skills we personally want to hone while we have the equipment here.
Yeah, this is Maxime. I would say maybe a few more scenarios would be nice to do a bit more practice on like different scenarios, but on the other side, I wouldn't have anything to like cut. So I understand the problem is just it's not enough time for all of this. Yeah, but I definitely got interested in like the TTEMS, where I think there will be a bit more insight in all the other things. And that's so.
So I have a question that's not about TTEMS. You're in the second year. Connor, you're starting your first year with us, which is year 2, and all of you are in year 2. So tell the listener, how is it going? What have you learned? What's the process been like that you are almost halfway through the bachelor's degree program?
So this is Connor. I'll start by saying the bachelor's with COROM is completely different from schooling I've done in the past. So coming from a USA background where I just have an associate's degree, the way schooling is just different. The higher level of learning, I would say, it's not just a mindless memorization. That's not going to really get you through the course or really help you in your practice anyway, right? So just kind of relearning how to learn properly, how to efficiently study, how to actually learn, your patho, you're recognizing different diseases. It's not mindless memorization. So you really do have to understand the concepts a little bit more in depth.
Yeah, this is Maxime. I'm basically in the same situation like Connor, just started into the second year. And yeah, definitely I can agree this is different to my prior education. There we had, of course, way more time in the classroom, not so many time. We had to work for ourselves. I would say that's definitely the biggest difference. And for me, actually having this first course here in person, getting to meet everyone, I think was very important. This is a big plus for the motivation when the things are getting less abstract and you're finally understanding things better from just like reading it at home, but actually practicing things and being able to ask somebody who already understands this.
So this is Splinter. I've really enjoyed the BSc so far. I was a little nervous about making the step into the BSc, but it has paid off probably 1,000-fold. It's a really clear structure in where you are now and where you're going. All the coursework and the modules, it's all really clearly outlined in what you're currently learning and what you're going to be learning next and where you're eventually going by the end of the school year. And there's no fluff. There's no tasks that you have to do in between. No fluff. So it's a really direct pathway to the place where you are now and the place where you're going. And having a rough childhood with schools and not really fitting in with the learning systems there, this has been really helpful for me because I can just go. I can just keep that ball rolling and move on and keep making the step, keep taking another step, and by the end you're done. And it's time to learn more and more and never end. So I'm really happy with the step I've made.
Finnegan, I want to add on to Splinter's points about past education. Something I quite like is that I'm learning on my own, probably the same as my past education, but I don't have the constraints of having to be in a classroom for X amount of hours every single day for 6 months straight, and then having to go home and do all of the learning because the teacher's terrible, the slides are ancient, whatever other reason. I think as well for for younger students or less experienced students like myself, being able to practice with people who are more experienced, not just them being the instructors, but them being my fellow classmates, it's making my developments a lot easier.
I just have one more thing to add. So this is Splinter. So in my first year, when Tim was our instructor and our teacher, he said something that's really stuck with me, and that's that everyone who stands in front of this classroom isn't a master at their craft. They're really good at their craft, but they haven't perfected their craft. And they are learning with the students, and they aren't teaching the students. And that's something that's really stuck with me and really has become kind of the face of the college, is that all these instructors are learning from the experiences of the other students as well, and not just standing there and giving their monologue about what they know and how much they know about it. They are learning with the students, and that's been a really positive impact on my learning experience.
Any other comments, lads? Well, tomorrow is your final exam and your OSCE. I wish you the best. Thank you for being here this week and making this interesting for us.
Thank you.
Easy enough.
This has been a presentation from the College of Remote and Offshore Medicine. If you would like to earn CPD credits for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credit, free access to our virtual field guide, and discounts on our e-learning courses. You can join the team on our college website at quorum.edu.mt.